If you enjoy this channel or this content, if you could drop a like or a sub, that would certainly be appreciated, and it really does go a long way.
So this patient's coming in for drainage of an inflamed lesion. How long's it gotten swollen like this for? Like a week or so?
Probably almost 2 weeks.
Yeah, so this is what typically happens. The message I say to residents who are looking at this type of stuff is, at this stage, when you get here, antibiotics will not settle this down. Like, this has to be drained, and because it's inflamed or infected, you can't take the cyst capsule out, so we just want to be draining this to allow it to settle back down so that then we can go back in at some later point. We need to sort of take care of that for us. So the other problem this will create is, from an acid-base balance, local freezing doesn't work as well when it's inflamed like this. So we want to make sure that we inject very superficially to try to pressure off those nerve endings and have the lidocaine work, and we try not to infuse it into the actual capsule. So this part does sting a bit. You're going to feel a poke here, and you want the bevel up to be poking it as superficial as possible. You're going to feel some burning. So this is what I want to see. I want it to be blanching just like that, to stay in the superficial area as best we can. You okay?
A little burning.
Yeah.
But it's okay.
So in these type of videos, like this is he's being stoic. This stings. So if you were to sit there, you wouldn't do this just for fun. Like that's something that's not comfortable.
It's not comfortable, no.
Nope. But this is also why when you see some videos and people comment that we should just extend this and do much larger blocks, if you've never had local freezing, it's not pleasant. You know, so you have to have a balance where certainly you want the patients to be comfortable. Now I'm going to add a little bit into just to try to get to a deeper, slightly deeper layer. But this is the one where you can risk getting into the capsule. Does that hurt a lot?
I don't feel it at all.
Okay, good. I see that. So that's when I just, the difference between where I was in the middle layers and then when I was actually into the cyst. So you saw that puncture ruptured a little bit. So here again, this area is doing well, but if I go a little bit deeper, still good. But as soon as I'm a little bit further in, I'm going to hit that area again. Not too bad, pretty good. Good. So does that hurt when I do that?
I don't feel it.
No pain, good. So this is our number 11 blade. This is the one we use for puncturing. And so this area, this is the area that was most fluctuant, and also because there's a puncture, I'm going to be going along that line. So the balance we want to have here, you okay there?
Yep.
So you want to have an incision that's big enough to allow this to drain. So you can see there that's keratin. So this is definitely a cyst as opposed to just an abscess. You okay?
Yeah.
So obviously it's going to be somewhat uncomfortable because I have to put pressure around those surrounding areas, and that's hard for them. So I want to be gently putting that pressure in different directions to get that to push out as much as possible. You can see there, that's membrane right there. And this is what ends up happening. This is why we can't take it all out. The membrane is just friable like that, breaks off in pieces. So intuitively, if you want to try to get this out, you'd have to have a much, much bigger incision, and you'd have to, is that hurting too much?
I don't feel it.
Okay, good. And you have to be digging after a lot larger section, because it's a lot like a balloon that's inflated when the cyst gets inflamed or infected. And you try to avoid those big incisions from a cosmetic perspective as well. So then I try and use a curette. Now you can use a curette. He seems to have decent anesthesia. Whenever I use any metal instruments, whether it be a curette or pickups or even tweezers, you have to be careful if you have poor anesthetic, because the metal part is harder on his actual tissues. If he doesn't have good anesthetic, you can use plastic curettes, you can use Q-tips, those type of things. Obviously, the firmer the actual object, the better it is at breaking down adhesions. That's not hurting too much?
I don't feel it, to be
Okay,
honest.
good. So the nice thing is it allows us to be a little bit more aggressive with this. So once I've done that, I'm going to irrigate this.
I wouldn't have done
He doesn't separate them. And then he opens the tops, which just sets me up for a... All right. So what I was just laughing at, the nurse I'm working with today didn't separate these, so I just spilled it all over myself, and that's okay. Put these down here. So this, I want to be putting pressure at different angles, just to sort of, again, same issue. Beyond cleaning it out, I'm trying to separate some cyst membrane if I can, or contents, and get it to break away, so this can clean out as much as possible. Very good. Maybe it's a joke he's playing on me. It's just, he knows it is. Oh, Dr. Brother spotted himself. You're still comfortable?
Yeah.
Very good. So once I've done that, you can see through here, you can see a bit more of the membrane that's there. So sometimes go after that a little bit more. And then you can ask yourself, well, why am I bothering with this if it's going to reform? The reality is you can sometimes get lucky if you destroy enough of the capsule, if you take enough of it out. There's a small chance that this doesn't recur. Again, that chance isn't fantastic, or else, again, we'd really dig after it. But if it's there and it's accessible, I'll certainly make the effort to sort of see if we can get that out. Otherwise, that looks nice and clean. So once I get to this stage, this is when we want to take our swab. Now, again, you don't always have to do this. I generally do it because, especially when we're teaching this, there's always some good information to be had when you get the swab back. A lot of these swabs won't grow anything, and that's what we expect, just from the standpoint that a lot of these are just inflammatory. But this is the stage where you want to do this. You want to clean this out because what we're looking for is live bacteria. So when we open that up and you had that combination of keratin and pus that was there, that's just dead cells. That's not going to grow anything. It's not going to help us. We're trying to find live bacteria so we can test and see what it's sensitive to and not sensitive to. So once it's like this, so I get in the habit where I'm going to pack this just overnight. So the advantage this creates is that obviously this stops any bleeding you may have. And the reason why I only do it overnight is consistent and recurrent packing is uncomfortable for the patient. So here he has some freezing in. But like I said at the beginning, there's some people, times even the freezing here is not fantastic. But certainly tomorrow there won't be any freezing. And if you just recurrently pack it, there's no point. I generally do it overnight, just because we make sure we maintain hemostasis, so we're not going to have, bleeding through and that type of stuff that's going to happen. But also it allows for, if there is components to this capsule that are loculated, so like pockets of infection, they can sometimes collapse into this capsule overnight or into this opening that we've created, and allow it to drain more properly tomorrow. But that's the only time I do it. So tomorrow, and sometimes I have to leave instructions for other clinicians who don't do this as much. You want to make sure that you only do it for tomorrow and that's it. So when I'm clipping this, a mistake to be made, and sometimes I've made this before too. Now these are clean scissors. If you cut here, this is close to the area of contamination. I don't want to compromise the whole bottle, so I'll cut up here and then get rid of that. And then I want to trim it back down here. And so now we'll just put a dressing on that, and then we should be good, and we'll see him back tomorrow.